Welcome back to EMT 101. I'm Rachel.
I'm Hannah.
I'm Lindsay.
Today we will discuss Chapter 22 on abdominal emergencies. Understanding the nature of abdominal pain and discomfort. Core concept number 1. There are many organs within the peritoneal and retroperitoneal cavities. These organs can be sources of wide range of problems or complaints in patients of all ages. Some classic patterns and types of pain involving the abdomen include visceral pain, partial pain, tearing pain, and referred pain.
Becoming familiar with abdominal conditions that may cause pain or discomfort. Although many conditions have classic signs and symptoms, there are many people who do not display them. Some patients may be pain-free with a raging infection inside, whereas others may be in ongoing pain from a minor irritant. Although diagnosis may not be the most important element of care, often disorders can be readily identified through common characteristics.
Core concept number 3. How to assess and care for patients with abdominal pain or discomfort. Diagnosing can be difficult. The focus of your assessment process will be to accurately perform a secondary assessment to describe the condition and identify potentially serious conditions such as shock. For each of the steps in the assessment process, you may observe specific concerns and points of interest in the abdominal pain patient.
Objective 22.2. The abdomen contains organs that perform digestive, reproductive, endocrine, and regulatory functions. The abdomen can be divided into 4 quadrants to identify and describe areas of pain and other abnormalities. Most of the organs are enclosed within the peritoneum, such as the stomach, liver, spleen, appendix, large and small colon. The organs in the retroperitoneal area include the kidneys, the pancreas, and the aorta. The solid organs include the spleen, liver, pancreas, and kidneys, and the organs that are hollow include the stomach, gallbladder, duodenum, large and small intestines, and the bladder.
Alright, first off we got visceral pain. Is poorly localized, dull, or diffuse pain that arises from the abdominal organs or the viscera. Next is parietal pain, whatever that says. A localized intense pain that arises from the parietal peritoneum, the lining of the abdominal cavity. Tearing pain, sharp pain that feels as if the body tissues are being torn apart. And finally, preferred pain. Pain felt in a location other than where it originates.
Objective 22.4. When a gallbladder is diseased, pain is often felt not only in the area of the gallbladder, but also instead in the area of the right shoulder blade.
Alright, objective 22.5. Signs and symptoms of appendicitis include nausea, sometimes vomiting, pain in the area of the umbilicus with pain in the RLQ. Pain becomes more severe when it ruptures. Alright, peritonitis can have fever and other signs of infections. The abdomen typically becomes extremely painful and rigid. Alright, Miss Vanna White over here with well, whatever. It says it right there. Patient will experience severe and sometimes sudden RUQ pain that can radiate to the shoulder. Pancreatitis. Common in patients with chronic alcohol problems. Pain is found in the epigastric area and may radiate to the back or the shoulders. Abdominal aortic aneurysm, AAA. Patients with slowly leaking AAA represent with gradually developing abdominal pain described as sharp pain or tearing pain and can radiate to the back. Hernia, a mass or lump, severe pain at the site of course, the hernia. Finally, renal colic, severe flank pain. Visceral pain is severe with nausea and vomiting.
.6. Pain from a myocardial infarction may be felt as abdominal discomfort. This pain is also felt in the epigastric region, often described as indigestion or digestive discomfort.
Objective 22.7. To assess and manage a patient suffering from abdominal pain, first perform a scene safe size up.
Scene is safe.
Look for clues, then perform a primary assessment including the general impression of the patient's level of distress, mental status, airway, breathing, and circulation. Make transport decision and consider oxygen. You also have to assist the patient to a position of comfort and to stay calm and reassuring. After that, perform a history, physical examination, and vital signs. Then perform a reassessment every 5 minutes en route.
Finally, we've come to the conclusion of 22.8. When taking a patient's history, use the OPQRST to gather information. When talking to female patients, please make sure you have privacy to make the patient comfortable, communicate with them, and ask some of these following questions. Where are you in your menstrual cycle? Is your period late? Is it possible you're pregnant? Some patients might not be aware they're pregnant.